I've always had pain in my ankle, even as a young child. But as I got older, it got worse. Throbbing constant once it started. It did not, I knew I was in for several hours of it, and there wasn't anything that I could take over the counter that would, dull it any. I like to get outside and work and garden, play with my grandchildren, and 2 hours into any of those activities and I was done.
I specialize in foot and ankle surgery, so I treat really any problem that involves the foot or the ankle. My practice encompasses both non-operative and operative treatments for foot and ankle problems. Even things as simple as an ankle sprain, if severe enough or associated with enough disability, can go on to require surgery.
I get to treat patients that are younger, that are middle-aged, and that are older, and I really like the fact that I treat men and women, young and old, problems related to sports injuries, problems related to aging, and problems related to trauma, problems related to neuromuscular disease like Charcot-Marie tooth disease and some of these other nerve and muscle disorders where creates weakness or deformity.
We have a great department here with a lot of very excellent surgeons, and then we have a lot of great specialties, subspecialties throughout the university. I mean, it's hard to find a medical center that's this complete, that has excellence in almost every area of medicine.
I was really apprehensive about any type of surgery.
I always tell my patients that we can always do surgery, but we can't undo it once we've done it. So it makes sense to try the non-operative therapies first, because if that's successful, they can avoid having to go through a surgery.
We did some physical therapy. They also did some injections to try to help relieve the pain, things like that. And then finally it got to the point, this is what there is left to do, nothing or this. And so with the pain getting worse, I went ahead and opted for the surgery, and I'm really glad I did.
First of all, I'd say that it's a great privilege to be able to take care of patients, especially in a surgical way. For a patient to come in and listen to what you have to offer them and then have enough confidence in you to basically go to sleep and then let you do what you think is right for them is an incredible thing. And so I think none of us really take that lightly.
Well, I think the most important thing that makes this department so special compared to really anywhere else are the people that work within the department. We have been so fortunate to basically grow into a group of orthopedic surgeons that strive for excellence, that are very knowledgeable in their subspecialties, and are up to date on all the latest and greatest treatments for a variety of orthopedic problems.
It's something worth doing. It's a little time out of my life, but it puts a great deal more back into my life as I'm able to do the things I want to do.
At the end of the day, when they say, I'm so much better than I was 6 months ago or a year ago, I can now do things that I couldn't do before, that's the most meaningful thing to me in the world.